How to get a correct CFS diagnosis. Imagine feeling exhausted all the time, even after a full night's sleep, and wondering if there's a way to find out what's really going on. Getting a correct diagnosis of chronic fatigue syndrome, also called myalgic encephalomyelitis, can be a complex process because there is no single test that confirms it. Instead, doctors relying on a thorough evaluation of your symptoms and careful exclusion of other health conditions that could cause similar issues. The first step is a detailed medical history and physical exam. Your healthcare provider will ask about how long you've experienced fatigue, how severe it is, and how it affects your daily life. They will look for key signs like fatigue that lasts more than 6 months, which isn't relieved by rest, and post-exertional malaise, meaning your symptoms worsen after physical or mental activity, sometimes delayed by a day or two and lasting 4 days. They will also check for unrefreshing sleep, memory problems, difficulty concentrating, muscle pain, headaches, sore throat, tender lymph nodes, and dizziness that worsens when standing up. The physical exam helps identify other possible causes of fatigue. Next, your doctor will order tests to rule out other conditions. Since fatigue can be caused by many health issues, they might check for sleep disorders like sleep apnea, thyroid problems such as hypothyroidism, blood sugar issues like diabetes, anemia, or nutritional deficiencies. They will also evaluate mental health conditions like depression or anxiety, which can contribute to fatigue. This process of ruling out other illnesses is called differential diagnosis and is essential because CFS or ME is diagnosed only after other causes are excluded. Doctors often use established criteria to guide diagnosis. The most accepted are from the Centers for Disease Control and Prevention and the National Academy of Medicine. These requiring that symptoms like fatigue, post-exertional malaise, unrefreshing sleep, and cognitive problems have been present for more than 6 months and cause significant impairment. For a diagnosis, patients usually need to have at least one of the following: cognitive issues or orthostatic intolerance, which is dizziness when standing. Symptoms should be present most of the time and be moderate or worse in severity. The duration and severity of symptoms matter. They need to have persisted for at least 6 months, and the fatigue must interfere with work, school, or daily activities. If the diagnosis remains unclear or symptoms are particularly severe, specialists such as neurologists, infectious disease experts, or rheumatologists may be involved for further assessment. It's also important to recognize that many people with CFS or ME may have other overlapping conditions like fibromyalgia, irritable bowel syndrome, or sleep disorders. These should be identified and managed alongside the fatigue condition for better overall health. In summary, getting an accurate diagnosis involves a careful clinical assessment, thorough testing to exclude other causes, and applying established symptom criteria. Because this process can take time and requires collaboration between patient and doctor, it's important to seek out healthcare providers experienced with CFS or ME. Remember, each person's experience is unique, and a personalized approach is key. Always consult healthcare professionals for diagnosis and treatment tailored to your specific health situation.